Hey, hello everyone. Thanks for coming. I just first I'd like to say that there is like a really I will probably forget or not get the time to say everything that's important, or maybe even get some things wrong. But like luckily, I think like the most of the things that are get forgotten to have already been said in the previous panels. So I'd like to also say that with regards to you saying Sweden is not as good as it looks, that sometimes like the systems that seem good are also obviously problematic, but by speaking about and comparing them to the more obviously problematic systems, it's gets that's a good way to maybe get more insight into how the systems work and why they are problematic. So hopefully that's something that comes out from my talk. So I decided to briefly include some of the neighboring countries as well in talking about mostly the legal systems regarding trans rights and healthcare. So maybe I would start with saying last week or 10 days ago or something, there has been the conference in Sarajevo in Bosnia and Herzegovina on call it transgender dialogue, trans as a question of politics and health. So I would say briefly that in specifically in Bosnia and Herzegovina, there is currently no legal status for trans or gender variant people whatsoever, which is also really difficult to start because the country itself is divided into 3 political entities, each autonomous in like the legal system. Then further, it's divided into 13 so-called cantons. I think, if I'm that all of them have their own health ministries and stuff like that. So it's really complicated to have a whole for the whole country to have the same system or whatever. But nothing exists so far as I know. Then Montenegro has passed a healthcare law that is for now covering all of the costs of trans-Pacific healthcare so far abroad, because there is no available trans healthcare in Montenegro. So most of the people go to, or the few people that are out and we know of, go to Serbia. This law states actually that 80% of the costs would be covered, but for now I forgot why they're covering, because I think they have to make a bylaw or something that would make it in practice 80%, but for now it's like covered fully. Then Serbia. Sorry. Also, I wanted to say that it's better for me and probably for you to, if you have any questions or you need clarification, to ask right away, because it's, I think, more practical or productive. Serbia, as far as I know, this is like speaking for people with citizenship, has also maybe 2 years, I'm not sure, but like in the very recent past has passed a law that includes, I think, 60 or 65% of the trans healthcare is covered, which is actually not obviously not good enough, but it's very important because in Serbia is one of the countries that has like the is probably mostly has a most structured system that of care providers, as I'm sure some of you know, because it's also pretty out there in the media and blah. So Serbia, yes. Then actually most of the people from Croatia have been going to Serbia up until maybe 3 or 4 years ago, when we have identified practitioners that were willing to work with trans and gender variant people.
Can I ask you something?
Yes, please.
How did you do that? How did you identify these practitioners?
One of the psychologists working in Zagreb who is one of the authors of the research that I would like briefly quote later has been working with on LGB and NT related care for some time. So I'm not sure like how it happened, but somehow it got like she got involved also in when we were starting the organization TransAid. We've been collaborating with her, and the rest of there is so from what's available from healthcare is psychological healthcare. There are also 2 psychiatrists, I think, working with people, and 1 or 2, actually, 1.5 endocrinologists, and also there is one surgeon who is doing mastectomies. So, and we have it was not a public thing that we identified them to be working. It was I'm not really sure how it happened, but someone found out and then they told everyone else, and then we started to also talk to them on the potential collaboration and education and stuff like that. Does that answer your question?
Yes,
okay.
yes.
May I just ask a follow-up? Are those individuals all based in Zagreb, or are they throughout or around other places in Croatia as well?
Yeah, actually, all of them except for one psychiatrist are working in Zagreb, and the psychiatrist who's not working in Zagreb is working in a city that's like 40 kilometers away, so that's not really a big difference. But yeah, all of the care is centralized in the capital. It's basically the same. So then maybe I can go on to Croatia. Okay, so as some of you might know, Croatia has entered the European Union on 1st of July 2013, but the country is still in a recession, so the economy is terrible. Even though the government right now is like a social democrat party, it's not working at all, and the poverty rates are extremely high, which I think is important to say because it reflects a lot on the lives and experiences of trans and gender variant people living there. Anyway, as far as the legal aspects in Croatia go, there have been changes in law on state registries, where they have include. This was, I think, 3 years ago, where they included like a special paragraph, or I don't know, of a so-called change of sex that was supposed to be regulated by a special bylaw, where the conditions would be stated on how to do that, actually. So on the 27th of March 2014, the Croatian Ministry of Health has adopted the so-called bylaw on the manner of collecting medical documentation and establishing the conditions and requirements for change of sex or life in another gender identity. So that's like, that says a lot. So it says that like if you want to change your legal gender, you have to do it with approval of certain medical practitioners. That but the good the good thing in this is the fact that you are allowed to do it as living in another gender identity, which would mean that they are they have written that you don't need any medical interventions to be able to do so, but which in practice should mean that you that you would need a letter of recommendation or opinion of a psychiatrist, psychologist, and a report from the social center, but no medical interventions are necessary. But this is not happening. The practice has been such that actually the bylaw states that the National Health Council is the one that you need to bring all of the opinions mentioned to, and then they decide if the opinions are okay and you can change your legal gender or not. So the National Health Council is actually a state body that usually is apart from being the law on this says something, I'm like paraphrasing, but it is a body that decides on national relevant medical issues. So it's like epidemics and stuff like that. and so epidemics and changing sex. So this has been a really big problem because they have been so far refusing to accept any people who have not undergone all or whatever medical interventions that are needed for a complete change of sex, whatever that means. That means like sterilization and blah blah blah. So okay. Anyway, so that's not working out with the bylaw, and that's partly because in the bylaw it's stated that after it's adopted, there should be a list of experts, so a list of medical experts put together or whatever, and that the Ministry of Health should write national guidelines for trans and gender variant care. But that's not that hasn't been they had the deadline for I think 60 days to do this, and it's been over a year and they haven't, so and it's not really working. Because
can I ask you something?
Yes.
Before you said something about we don't have guidelines, but sometimes I feel it's a good thing not to have the guidelines. Can you elaborate a bit on that?
Okay, so it's good. sometimes it's good in terms of like getting access to healthcare, but it's really definitely not good in this case where people are not able to change their documents. But when it's good for healthcare, it's because, well, for example, there is the national healthcare system doesn't cover costs of anything except for psychologist and psychiatric treatment or whatever. So that means that people have to pay for hormones. They have to pay for. Okay, actually, they don't. In practice, they don't have to. Like, this is a good thing. There is no official coverage, but people are able to, for example, get the mastectomy for free. I think it's done like under a different diagnosis, because the diagnosis F640 doesn't cover anything. So that's a kind of a good thing.
To go round it, or
Yeah, but that all depends on like the goodwill of the health practitioners, which is a bad thing, because if there were like a list of what's covered or not, that like, and that everything that should be included would be included, would obviously be a better thing. But sometimes like it works out when you, I don't know, speak to your general practitioner, and then this can help in like maybe getting hormones somehow, but it in practice it only works for women. While I'm saying this, it's also like, I think it's important to say that like due to the one of the like the economic situation, and also the like having to pay for hormones is like difficult for most people. And like further, Serbia, which was one of the main sources of testosterone, has like their pharmaceutical company has stopped producing testosterone like a year ago. So there is like the people are only able to buy Nebido, which is extremely expensive, and most can't afford it, which is like really bad. And I don't know how people are getting the hormones if it's not covered, and if they're not able to pay for it, because they're not able to get the job, because they're not able to change their documents, and then it's like a circle of not being able to do anything. So what am I forgetting? Okay, so healthcare, as yeah. So there is basically nothing is covered, but some things can get covered under a different diagnosis. But it's really obvious, I think, for everyone in the room that everything should be covered. Yeah. So what I thought might be good to say is that in regards to mental health care, there is like I think there is a difference from like receiving it from the state and then also receiving it. There's like a possibility to some NGOs offer like psychological counseling that are inclusive. Some are not. Then also
what kind of NGOs?
Like there is, for example, actually how one of the reasons why TransAid was started was because the lesbian organization in Rijeka had a trans conference, which was like, because there was no trans organizations before that, no to organize a conference themselves. So they invited people to come there, and they have, for example, also a counseling, but that's it's also good that it's in Rijeka because all of the other things are in Zagreb. But also, I think it's important to say that, like, for example, shelters for victims of violence are not, like, most of the time it's not really possible for trans people to get help there or to, like, use them, which is not a good thing when there is a lot of, like, there is a lot of poverty within the community, and, like, people are getting kicked out from houses, so they don't really have a place to stay, and if they're victims of violence, they don't get the help from the shelters that are supposed to offer it. But yeah, so I think that's kind of the basic framework of where the Croatian healthcare system is. So I could now maybe quote some of the research that the psychologist Iva Čegura from the University Psychiatric Hospital of Vrapče, who is one of the two psychologists working with trans people, and one of the two psychiatrists has done this year with trans people who are already within the public healthcare sector, so they are in the system as patients or whatever. I think most of them. So this was an online survey, and as Jos and you, Carolina, mentioned before, it's very difficult to interpret an online survey, and there are some things that are not really representative in terms of the general population. So this survey had 45 respondents who are trans or gender variant people. And if I'm interpreting it correctly, it mostly focuses on the differences between people identifying within the M2F and F2M spectrum in relation to the various forms of violence experienced, the life quality, the life satisfaction, and perceived social support of the respondents. Okay. Also, I would like to say that it's very important to contextualize the results of this survey within the very sexist and misogynistic cultural and state structures that I spoke a little bit about that affect the lives of trans and gender variant and actually all people in Croatia and everywhere through both the legal administrative systems that are still very inaccessible to most. Also, for example, the transphobic images distributed in the mainstream media, in the mainstream Croatian media, and in the region that produce and reproduce things like internalized transphobia. And that's actually something that I think the survey shows very good. So now I am quoting from this. Okay, so they have actually done another research, but it was on an LGBT sample, so they were comparing results from that one to the one that was only focusing on trans people, which is, I think it's, from what I know of sociology, it doesn't really work well, but some things are stated. So they have found that the total rate of violence experienced in the transgender sample is higher than in the previous research, so this one in 2015, and that M2F persons show significantly lower levels of quality of life, but experience significantly higher levels of sexual violence in comparison to the F2M persons in the sample. So a little bit about the sample. Okay, the majority of the sample, this is the online survey, so that's what the sample is. is like 53.3% live in a large city, which is probably Zagreb because there are not so many large cities. 17.8% live in a small city, which is like population around 100,000. 15.6 live in a small town or village with population of less than 10,000 inhabitants, and 13.3 live in a city with population of less than 500,000 inhabitants. The standard of life for most respondents was described as average, which is 48.9%, but 28.9 of them estimated their standard of life as below average. I would like to say here that like most people that I know that are trans people that are below average don't even have access to internet, so this is also kind of not representative within the online survey. Also probably don't have time to fill out surveys anyway. The 22.2% describe their standard of life as above average. Concerning level of education, there is 42.2% of people with completed secondary school, 33 with a university degree, 15 with a bachelor's, and 4 only elementary school. Okay, and also 4.4 have some kind of PhD or specialization. Okay. So a little bit about the quality of life versus experience in terms of experienced violence. There is a paradoxically positive, significant correlation, obviously, between experienced psychological violence and quality of life. I mean, that's like very logical. We may speculate about possible causes of this correlation. One of them may be due to the methodological problems of this research, particularly because of small sample of M2F subjects, but we have to be very cautious in explaining these correlations, and further research is needed to make it clearer in a light of scientifically objective way. The other significant negative correlation is found between the experienced levels of psychological violence and quality of life among F2M sample, pointing to the fact that transgender men who have experienced lower levels of psychological violence have higher levels of quality of life, which is also, I think, very logical. So then a little bit about the satisfaction with mental and medical health care. Also, this is like, I have to say that most of the I think most of the people who participated in this survey are patients of the person who did the survey. So that's also something to take in account when reading these numbers. 80% of trans participants consider psychologists as the most competent and affirmative professionals concerning, yeah. I mean, but that is like I would agree with this number, but it's also, yeah. Anyway,
somewhat funny.
Yeah, it is somewhat funny. Okay, but then 15.6 say that for psychiatrists that they are the most competent, and 4.4%, only 4% consider endocrinologists as the most competent professionals to deal with transgender health issues. 28.8 of the participants are mostly or completely satisfied with mental health care, in contrast to only 6.6 of those who are satisfied with medical health care. So, I mean, that's also very logical when you know that there is people who, health practitioners in like the medical healthcare system have been have started to do this like very recently and are haven't been educated enough and should get more education, obviously. So, but Yeah, I think that's what I wanted to say. And that's what it also says in the conclusion of their research. So most of the results point to the urgent need for education about transgender issues for all health and mental health professionals included in the care of transgender persons, but also for the education of general public to stress the issues of transphobia. So I think we all know this. So
Yeah.
we already know
Yes,
this. Yeah.
we know it.
Yeah. So that's like, if there are any questions now, I could.
Thank you.
Yeah.
Hey, I'd like to know if there is anything specific TransAid or the Croatian government is doing about HIV and transgender people, persons in your country.
Yeah. No. No and no. Yeah. But we have, there is a gay rights organization that is like doing HIV prevention in MSM populations. So they have, like, last month they have contacted us to do something also to try to include the trans population as well. So I think and hope that that works out and that we can start to do something. Yeah.
Yeah. Okay. Yeah, you have been touching upon that and different aspects of it. I was wondering about the sort of activist situation in Croatia and, well, LGB, but also then specifically the sort of trans activism, and that you mentioned obviously the sort of general situation in the country and the poverty aspect and so on. But yeah, if you could say a bit more about how the situation, the activist situation for
Yeah.
trans is.
Yeah. I think there's like, from what I see recently that's going on, is that there's very few people who are able and willing to work or be active, and there's like the capacity for this is like very low, but we have an okay collaboration with, like, for example, LGBT or LGBT organizations and some feminist organizations as well. But I mean, things could be better, of course, always. But I think it's there's
And you recently started a network.
Oh yeah, right. That's why I also talked about the region. Sorry. Yeah, this is like a
Great,
very,
please.
very important thing. I think, like, TransAid organized a transposium in September last year, and there we have, like, formed a network of people from most of the ex-Yugoslav region. So and who are most active are like Croatia, Serbia, Slovenia, and Bosnia and Herzegovina, and Montenegro. And that was kind of thought as a platform, like mostly online platform for people to share their experiences, which is like really important because there's like very little experiences because the movement is so young, and also there is like very few. I mean, the change is going really slow. Like, from what you can see by this, like, I mean, we have this bylaw now that we've been working together with the government on, but it's still not working, and people are still not able to change their legal gender, but I think the biggest problem is like capacity and the amount of people who are able to or willing to be involved in this kind, like in any kind of activism. So yeah.
I thank you for a very interesting presentation of the situation in Croatia. I just looked in the membership base of the World Association for Professionals. Here's one person for the whole of the region, which is a member of the W Path. And this is one of the things that I was thinking about. It would be so interesting to be in touch with you, and that you could also provide us with names that you know through your work are doing stuff for trans people, but for some reason, maybe it's the money, maybe it's because the world organization seems like too far away to be important for them, but maybe that we as EPATH can connect with them and also offer them our support and see how we can work together, because I think a few of the people from Zagreb, and especially the one from Belgrade and other countries around, were at the conference. So they are very active in research and in clinical practice, but they are not member of any kind of those platforms. So that would be very interesting to also compare how they do what they do, and to get them in touch with other centers who are also working.
Yeah. I think like probably one of the two main reasons for this is that like they have only like in time related very small experience in working with trans people, but also because all of them are working in the public healthcare system, which is really badly structured in for everyone. So they don't really. It's like a lot of hours, so a lot of things going on, and there is no, like, for example, one of the psychologists who is the author of the research, who has also been to the I think the EPATH conference, is I think she got like they gave her like 4 hours a week for a gender not clinic, but gender something, 4 hours a week, I think. So, and then she has like all the other patients as well. So it's like very capacity-wise. Again, it's really stressful. But I will definitely. We are in contact, so I will advise them to. Yeah.
Exactly, because that's also, I think, a way to help each other is also sharing experiences on how other gender teams have succeeded in setting up a gender identity clinic, because they have gone through the same difficulties and problems and have had to overcome the same obstacles, I guess, in finding and getting time to do the stuff that they do, and fighting with their fellow doctors and surgeons to be, allowed to do this trans healthcare work. And so I think also exchanging this kind of experiences from clinic to clinic within the same setting, or from public authority to public authority, can also be very fruitful. So yeah, we should be in touch.
Yes.
So I think there are more people in the room maybe who know practitioners who should be involved with EPATH. So either you can hatch JAWS now, or you can get contact information from me. Yeah, I think we should try to wrap this up so we can have a break. But if there is one more question, we could.
Maybe can I just ask, in relation to TransAid Croatia, the group's work in relation to healthcare, have you like a set of priorities or things that you're sort of trying to achieve or work on specifically with regard to healthcare, that you've thought, well, maybe this is an easier thing to get rather than more difficult things at this stage, like a sort of priority list? Such?
Yeah. Well, not that I'm aware of.
That's okay.
But I think we are kind of maybe too optimistic, but we are aiming for like getting the full health care covered, because for example Montenegro is like a really religious, very conservative country, and they like got this 80, actually 100% coverage in like a few months, and it's a piece of paper that's like maybe half a page, and nobody really bothered a lot on it. But I mean, like from the ministries, but it worked, and I think that's also maybe possible. So that's kind of what we are going for now, is like to get everything included in because the healthcare is the provider then is national, but it's kind of divided a little bit from the Ministry of Health. So we have to do it directly with them, and so but then also have to. I don't know. It's like a weird situation, but yeah.
You're going for everything then.
Yeah.
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 Yeah. Okay. Thank you very much, Nika.
Okay, thanks.
And thank you.